quite the Jetsons, but the influence of robotics in our lives is increasing, with everything from robotic vacuum cleaners to automated assembly lines now part of daily life. And one of the major areas of influence has been in the field of medicine.
A study that's just been published has managed to quantify the benefits of using robots for some surgical procedures. Dr. David Speakman is from Melbourne's Peter MacCallum Cancer Centre, and he joins us now in the studio. David Speakman, good morning. Thanks for joining us.
Good morning. Thank you.
When we're talking about robotics, what do we mean?
Well, in this case, we're talking about using a robot to actually remove the prostate from patients. So it's robotic-assisted prostate cancer surgery. So in this situation, the surgeon, rather than having his hands right in a person's abdomen, is operating the robot remotely from another area of the operating theatre.
Why?
Yeah.
Well, we believe that, particularly in hard-to-get-at places like the pelvis, where the prostate's located, the robot enables you to get much closer, with much better vision, and also to use much finer movements to be much more precise with what you're doing in removing the cancer.
And how is that more effective in terms of patient outcomes from these sort of surgeries?
Well, our head of robot surgery, Associate Professor Declan Murphy, is just presenting now in the United States in a big meeting in Orlando to say that research we did here looking at prostate surgery with the robot and all prostate surgery in Victoria showed that if you had surgery with the robot, you were out of hospital quicker, on average just 1.4 days in hospital, compared to the old way of open surgery, we're in hospital for about 5 days. And so not only is that's a benefit, of course, to the patients, which is fantastic, but also to the whole health system in the saving of bed days so other patients can use the beds.
What do the surgeons themselves say about the experience of using robotic techniques?
I think they all think it makes life much easier, certainly on your back, and you're able to do longer procedures because you're sitting in a more comfortable position. And I think they love the fact that the optics and the technology really enable much greater control further away from where you would usually be holding your instruments. Traditionally down in the pelvis, you'd be using long instruments 15 or 30 centimetres away from your actual hand. With the robot, it's like your fingers are actually moulding or crafting the prostate out of the patient.
And I'm assuming the robots don't come cheap, though. There are benefits and there's also cost.
Indeed, they don't. And part of this study was to look at the economic issues around that. And we're pleased to be able to say that if you were doing around about 140 cases per year in your centre, then the cost offset of bed days saved would equal the cost of the outlay for the very expensive equipment.
How much are they, for instance, for each of these robots?
The robot, currently, if you bought a new robot off the shelf today, would be around about $4.5 million.
Right. And how many of those would we need for you to say that they could really take over
this
the role
research would indicate that in a place like Victoria, we probably should be having 4 or 5 robotic centres throughout the state, certainly in terms of prostate cancer surgery. And that, again, if you're up around 140 cases, then that gets the tipping point where it comes from a very high cost to making it much more financially viable. And indeed, you actually start to see savings once you place that target.
The cost of healthcare and the funding of healthcare is very much top of mind at the moment and top of the agenda with, in particular, the federal budget that's just been handed down. Do you have a view on how this plays out and the consequences it might have for the kind of work that you do?
I think that in health, it's incumbent upon us to always look for ways to save money, to do things for the same benefit to the patients, or indeed better benefit to the patients at a less cost. And I think the robot's a perfect example of that. The other great thing about the robot, for example, is that cases who had robotic surgery required less blood transfusions, which obviously is associated with a lot of problems. In open surgery, about 15% of patients needed a blood transfusion, and in the group, at least at the Peter MacCallum, no patient required a blood transfusion. So that again saves you from the possible problems of using other people's blood, but also in terms of the global health benefit to everyone, I think that's fantastic.
Yeah, just so we're clear, is the manufacturer of these robots playing any role in the promotional activities and
they've had nothing to do with this.
The teaching of of the use of the robot?
So they've had nothing to do at all with the analysis of the robot in the public sector. They, of course, help train you when the robot's first introduced.
Look, while we've got you here, and particularly given you're from the Peter MacCallum Centre, there's a story, I think we can have a look at it at the moment. A very high-profile Victorian, someone I think who'd be well known around the country, has just been treated with what's being described as a miracle life-saving job. Ron Walker, who a high-profile Liberal in Victoria and also former chairman of the Grand Prix Corporation. Yes. And he's had a melanoma cancer and has been treated with a, I think what's described as an anti-PD1 melanoma drug? That's
correct. So it's one of, we're lucky in melanoma where there hasn't been much effective treatment if the melanoma spread for years. In the last 2 or 3 years there's been an explosion of new, not new technology, but new drugs, designer drugs if you like, for the treatment of melanoma, where the treatment's far more melanoma as opposed to these things are just attacking the cancer and the rest of your body's spared. And so the drug that Ron was on, that's correct, called anti-PD1, is a way of stimulating your immune system, your own immune system, to attack melanoma cells in preference to anything else. And I think that certainly of the three, there are now 3 great treatments around for melanoma, and PD1 on the early data looks like it's going to be out there as a major weapon against the fight against melanoma.
Yes, so this drug is now going to be approved for general use. Was it sort of used as an experimental level on Ron Walker, if you like?
Absolutely. When Ron was on it was as part of a clinical trial, and of course at Peter Mac we're very keen on clinical trials to prove that the stuff we're using works, and particularly if it's high cost, we want to see a clear benefit. And I think that these 3 new drugs in melanoma have in fact all shown a very good cost-benefit ratio.
David Speakman, good to meet you. Thank you very much.
Thanks very much.
Nice to meet you.
Thank you. Now, many of our former champion swimmers have